Okay, today we will be discussing infrastructure racisms into the South Bronx, asthma. Um, you cannot talk about the infrastructure of New York today without talking about Robert Moses, the man behind it. He destroyed many communities of colors in the name of building highways, buildings, bridges, and the modern day New York metropolitan made New York car centric, destroy many parks, rivers, forests, and other things. He was willing to spend misinformation. He was able to go against mayors, destroying public transportation, public hospitals, public schools, and things that many communities of colors depended on. He was also someone who had a prejudiced views. His legacy did not only stop in New York, but it also spread around to other part of the country. Um, the layout of the highways and fractured racism in the Bronx, the layout of the highways in the Bronx was especially disadvantaged to the communities of colors, and also it puts advantage people with higher income and also white. It destroyed communities of colors in the name of making increasing travel for people white, for those people who were living in the suburbs to business districts like Manhattan. During the building, most of these communities of color couldn't afford to move out of the neighborhood, so they were trapped almost also. Um, the health effect of it. South Bronx was part of those sacrifice zones with low income socioeconomic status. Also, it was a place that had a cheaper land. Due to this, the air quality in the Bronx is not the best, especially in the South Bronx, leading to high rate of hospitalizations due to asthma. Air pollution in the Bronx. Bronx is among one of the counties with the highest incidence of asthma emergency or hospital visits. The traffic pollution is especially hard during high, especially during weekdays. Um, Traffics have a very big impact on the amount of air pollution individuals inhale. Smoke, especially a lot of this air pollution come from diesel vehicles in suburban areas like South Bronx. This is a map that show asthma hospitalization between kids who are 4 to 14 years old. As you can see, the darker orange part is the one with the highest amount. And you can see most of the Bronx is literally like mostly like dark orange colors. Rarely do you see the white colors or yellow one with the lower. All you see is dark orange, showing truly the devastation of asthma in the Bronx compared to the rest of the city. This is a adults with asthma. This is a 2020 data. New York City had around 900,000, 14% of the city population. Bronx alone have 215,000, 21% of its populations. Manhattan have 2,000. Um, Manhattan have two 200,000, 15% of its population. Staten Island have 49,000, 13% of its population. Brooklyn have 238, 12% of its populations, and then Queens have 203, um 11% of its populations. Changes being made to reduce asthma rates in the Bronx. They are focusing on children's, especially providing to help these students control by, for example, offer like having programs to offer home visits to these children to see trigger things around them in the environment that can trigger asthma attacks. They also make how medications like asthma pumps more available to these children's. Um, Reducing asthma hospitalization can lead to reduced school days these students miss. Um, Provide better environment can lead to these communities having better health outcome. And these are my reference.